Go.
Yes.
Hi, my name is Ruby. I'm going to be your nurse today.
Hello.
Really quickly, do I have consent to go ahead and film this assessment on you today?
Yes.
Okay, cool. Can I get your first and last name and date of birth?
Yes. It's Michael Wolverton, February 3rd, 1999.
Okay. And then do you have any allergies that I should know about?
Yes. I have a sulfa allergy.
And what happens when you have anything with sulfa in it?
I get itchy and I get rashes.
Itchy, rashy. Okay, all right. Really quickly, so I'm going to be doing a lung and cardio assessment on you today. Do you know what brings you in, what issue you're having?
Yes, I'm having some shortness of breath and both of my legs, they're swelled up, and I noticed that there's like some discoloration.
Okay,
And I have some left thigh pain right here.
okay, okay. Oh.
It's a like on a numeric pain scale. What's 0?
Oh, okay. So we're going there. Hold on. I was gonna ask a series of questions,
Okay.
but
Okay.
instead of that, you don't know the whole story. It's okay. So with the leg pain, 0, scale of 0 to 10, how bad is it? 10 being the worst pain that you've ever felt.
About an 8.
Okay. When did you start noticing the pain in the leg?
It was very abrupt.
Okay, abrupt.
Yeah.
So how many times a day is it hurting, or is it throughout the entire day that it's hurting?
It's like throughout the entire day, whenever I walk.
Okay. And what kind of pain is it? Is it like a throbbing pain, a stabbing pain?
Throbbing.
Throbbing pain? Okay. So I'm gonna ask just a few questions.
Okay.
Do you have any shortness of breath?
Yes.
Okay. Do you know what brings on the shortness of breath? What you're doing while you have that shortness of breath?
When I'm walking,
When you're walking? Okay. And what makes it better?
not walking.
Not walking and
It's
resting.
resting, yeah.
Okay, okay. So with the shortness of breath, so not all the time, or is it all the time?
Just when I'm walking, I get shortness
breath?
of breath. Yeah, but when I sit really down, it's okay.
Okay, okay. Do you have any lightheadedness that accompanies that?
No.
Do you have a cough?
No.
Are you getting up at night to go urinate frequently?
No.
Okay, do you have any history of hypertension, diabetes, or high cholesterol?
No.
Do you have any previous history of cardiac or pulmonary issues?
No.
No? Okay. Are you up to date on your immunizations, like your TB, your
No.
flu shot?
Mm-mm.
You're a little too young for the pneumococcal, so we'll go ahead and we won't pay attention to that one.
Okay.
Alright. Do you have any swelling in your legs or feet? I know you said there was some swelling down at your legs.
Yeah, both of them.
Okay, both of them. When did you notice that was happening, that they started to swell?
Like about 2 weeks ago.
2 weeks
I noticed
ago?
they were like a little solid, and then all of a sudden it
It
just.
just progressed
Yes.
over time?
Yes.
Okay, all right. So now that I've asked you these few questions, is it okay if I begin my exam?
Yes.
Okay. I'm going to go ahead and examine the posterior chest. I'm going to go behind you.
Okay.
But before I do that, I want to note that the patient's appearance seems to be well-groomed, dressed for the occasion, the season outside. The patient is responding with clear responses, no sign of any abnormalities. So looking at the posterior, the client is also ANO ×3 in the beginning when I asked where the name, date of birth. So now I'm just gonna look at the back of the chest, or the back of the back. The color is evenly distributed. There are no signs of pallor or cyanosis. There seems to be no sign of any struggle with breathing or anything like that. And both of it both sides of the back of the chest are even. So you're gonna feel my hands on your back, and I want you to go ahead and take a deep breath in and out. Okay, so the chest rises and falls equally bilaterally, so no abnormalities there. I'm gonna check for tactile fremitus. So every time you feel my hand on your back, go ahead and say 99 for me.
99. 99. 99. 99. 99. 99. 99. 99.
Okay, no abnormalities with the tactile fremitus. No increase in the tactile fremitus. So now you're going to feel me auscultate in the back. I'm just going to be listening to the lobes of your lungs. For this assessment, I'm only going to be doing 12 sides, and there's normally 18. So every time you feel my stethoscope, take a deep breath in through your nose and out through your mouth. Okay, good vesicular sounds. No adventitious sounds noted. I didn't hear any crackles or anything like that. Sounds overall clear. All right, so now that I'm done with the back, I'm going to move over to the front. So just on inspection, there's no use of accessory muscles while breathing. The color of the skin is evenly distributed. And she appears to be equal on both sides bilaterally. So now I'm gonna go ahead and do tactile fremitus again on the front. So every time you feel my hand on your chest, go ahead and say 99.
99. 99. 99. 99. 99. 99. 99. 99.
I'm gonna check this side room.
99.
Okay.
Okay.
One more than usual, but it's okay. And then no abnormalities with the tactile fremitus. It's normal vibrations. Now I'm gonna go ahead and listen to the front lobes really quickly. All right, and I'll also be listening to 10 sites before I begin. So every time you feel my stethoscope, go ahead and take a deep breath in through your nose, out through your mouth. Breath sounds are clear, no adventitious sounds noted. And again, no struggling with the breath or anything like that. The breaths are smooth. Okay, now I'm gonna go ahead and put my stethoscope up really quickly. I'm gonna go ahead and assess the neck really quickly. So can you go ahead and lift for me your chin? The trachea is midline. I do not see any jugular distension currently right now. So I'm going to go ahead and palpate your carotid artery really quickly. I'll do one at a time. All right, the pulse on this side is 2+. We'll do the other. 2+ on this side as well. And now I'm just going to listen for any bruise on your carotid artery. So go ahead and take a, before I start, go ahead and take, you're gonna wanna take a deep breath in, hold for a little bit, and then release.
Okay.
Okay. Okay, I can hear good bronchial sounds. Okay, no bruise noted in the carotid arteries. Everything sounds clear. Again, I was hearing some good bronchial sounds from there too as well. So now I'm going to go ahead and listen to your heart sounds. Would it be better if you're sitting or laying down?
You choose.
Okay, that's great. If you can, it might be a little bit easier for me to get around your chest if you lay down. if
Okay,
that's okay.
yeah. Let me take my shoes off.
Okay, right. I'm gonna raise the bed just a little bit, trying to find my working height. And now that she's lying flat, I can also continue to assess for jugular vein distension. I am not seeing any. I'm gonna use my light. I'm not seeing any signs of JVG even at this angle. So now I'm going to go ahead and just listen to your lung sound, your heart sounds. So you don't have to hold your breath or anything like that for
Okay.
these. So I'm going to start with just overall. All right, so starting on the right side, I'm going to go ahead and listen to the aortic. Now the pulmonic, good strong heart sounds. Now to the Erb's point, really good clear lung sounds. Now I'm going to be listening to the tricuspid. And now the mitral. All right, and I'm going to turn my stethoscope over. I'm going to listen for any murmurs, okay? Okay, everything sounds good. I'm going to go ahead and listen to your heart as well as feel one of your pulses, if
Yes.
that's okay with you.
Which one do you want to do?
So just go ahead and relax. And typically you would just listen for about a minute. Oh. That's what I said. Okay. Everything sounds good. I'm going to raise the head of the bed just a little bit as well. Let me put this back up. Okay, pull this up. Oh, there it goes. Okay. And with raising the head, again, I would notice any jugular vein distension. Which currently I do not. All right, so really quickly, I'm just going to assess your upper and lower extremities. So I'm going to feel for the temperature. The temperature is warm. The skin is dry. The color is evenly distributed. I don't see any cyanosis. I don't see any pallor. So now I'm going to be feeling both of the pulses, the radial pulses. And I'm feeling about a 2+ bilaterally, so that's good. Yeah, good perfusion. And then I'm going to be checking for capillary refill. All right, less than 2 seconds, so we're good up here with your capillary refill. And then now I'm just gonna assess your legs if that's okay with you. I know you did say you had some edema on your legs, you had some fluid buildup. So I'm gonna go ahead and note the color. I know you did say there was some discoloration in one of the legs.
Yeah.
So typically you'd see cyanosis or erythema on the leg that is having pain, correct?
Yeah.
Okay. So the skin on that side of the affected leg feels to be a little bit cooler than the other leg. So that is something to note. And I'm going to go ahead and check for edema on this bony prominence on the outside of the ankle. And so normally if there was edema present, like what the patient had explained earlier, you would see some pitting. Is it okay if I take off your socks? So all I'm doing now is I'm going to palpate for the posterior tibial pulses on the insides of the feet. I'm feeling 2+ bilaterally, and now dorsalis pedis. 2+ bilaterally, and then capillary refill. Because there is some toenail polish on this toe, I'm just going to use the tip of the toe. Less than 2 seconds. Bilaterally. Fix your socks. Lower this. Okay. So now I'm done with my assessment. I want to thank you for cooperating with me today. I'm going to go ahead and lower your bed really quickly.
Okay.
Are you in a comfortable position?
Yeah.
Comfortable? Okay. All right. And make sure that your bed is locked. Right here. Good. The bed is locked, and then here's your call light.
Thank you.
And if you need anything, please let me know. Do you need anything from me right now?
No.
No? Okay. All right. Thank you so much for cooperating today. Your bed rolls are up, so that's good.
Okay.
But yeah, if you need anything, just hit the call light button, this red light right here.
Okay. Thank you.
Awesome. Thank you. Okay.